Hi, my name is Jillian Carrick. I am a senior in the School of Arts and Sciences, majoring in genetics with a minor in psychology and a certificate in genetic counseling. This summer, I worked with a graduate student, Sydney Clevenger, and we worked in investigating unexpected findings from expanded carrier screening and assessing the sufficiency of genetic counseling for these unexpected findings. So carrier screening is primarily used to identify carriers of recessive conditions, and expanded carrier screening is used in preconception and prenatal settings to determine carrier status for a variety of autosomal recessive and X-linked recessive traits. And when you use expanded carrier screening, hundreds of these conditions can be tested simultaneously. So normally when a patient is considered a carrier for a genetic disorder, they don't usually show symptoms, but we have been identifying and studying unexpected findings. And one specific example of an unexpected finding is if a patient is what we call a manifesting carrier. And as you'll see in figure 1, I have summarized what a manifesting carrier is. So that's when an individual is heterozygous for an autosomal recessive disorder, or if they have, if they're a female and it's an X-linked disorder, that's when one X chromosome is affected and the other one is wild type. So manifesting carriers are at risk for passing this carrier condition off to their offspring, and they also have a personal risk for expressing a phenotype for this disorder that wouldn't normally present a phenotype in carriers. So expanded carrier screening is not only important for preconception, but it's also important for personal health for these manifesting carriers. So genetic counseling is important for these individuals, and the purpose of the study is to assess whether these individuals are getting adequate counseling. So figure 2 outlines how this study was conducted. So over 4,000 patients' charts were located in the electronic medical records for Robert Wood Johnson, and we identified which patients could be part of this study through January 1st, 2015, all the way through December 31st, 2020. So these patients that were included are those who received expanded carrier screening and are those that have a disorder that are associated with manifesting carriers. We recorded the expanded carrier screening pursued by each of these patients, the number of genes that were tested, and the methodology of the specific expanded carrier screen, which was either genotyping or sequencing for all of these genes that are associated with disorders that have carriers. So, and now using this information and notating which patients are manifesting carriers, we will continue to assess the sufficiency of the genetic counseling that each of those patients received and how often these incidental unexpected findings occur. And we will also determine whether these patients' personal medical management will change as a result of their expanded carrier screening result. So I would really like to thank Sydney Clevenger for all of her patience this summer with navigating the electronic medical records with me, and also for training me on how to use everything and how to conduct this study. I would also like to thank the Genetic Counseling Certificate Program and the Douglas Residential College for giving me this opportunity this summer to contribute to this research, and I'm really excited for these future directions that we have and what we can do with this data to assess how efficient the genetic counseling has been for these manifesting carriers. Thank you.